We are going to learn the acupoints of the stomach meridian. This meridian goes from Chenqi to Lidui, bilaterally, each consisting of 45 acupoints. The general distribution of it is like this: 8 acupuncture points on the head and face, 4 points in the neck, 18 acupoints in the chest and abdomen, 15 acupuncture points in the lower limbs. First comes to the 8 points on the head and face. They are 承气、四白、巨髎、地仓、大隐、颊车、下关 and 头围. The 8 acupuncture points of this head and face are mainly used to treat the diseases of head and facial features, such as twitch of the eyelid, night blindness, red face, vertigo, toothache, epistaxis, and so on. On the operation, pay attention to this acupuncture point called 承气. This acupuncture point is in the orbit, the specific operation method used to further study. The neck has 4 acupoints from 人迎 to the 缺盆. The names are 人迎, 水突, 气摄, and 缺盆. They can treat diseases like cough and some diseases of thyroid gland, neutral, tumor, facial nerve episode, facial musculospasm, cheek swelling members, trigeminal and so on. The main point of attention in operation is 人迎. It is in the neck at the pulsating site of the common carotid artery on the anterior border of the sternoclavicular mastoid. The deep layer of the acupoint has cervicovascular system. It has internal jugular arteries, veins, and vagus nerve trunk. It has the cervical sympathetic trunk after. Therefore, do not press the anterior border of the sternocleidomastoid and the common carotid pulsar at the same time. The chest has 6 acupoints from 气户 to the 乳根. They can treat cough, asthma, chest pain, breast disease, heart disease, intercostal neuralgia, and other diseases. The operation should be careful. We can only apply or flat step 0.3 to 0.5 cun. If the puncture is too deep, we may cause pneumothorax. 乳中 is only used as a marker of positioning, not acupuncture or moxibustion. Abdomen has a total of 12 points, divided into the upper abdomen and the lower abdomen. The upper abdomen starts from the 部容 all the way to the 滑肉门. They can treat vomiting, abdominal distension, stomachache, loss of appetite, hematemesis, cough, and some heartburn, bowel diarrhea, edema, enuresis, and other diseases. Some acupuncture points such as 太乙 and 滑肉门 can be used for abdominal acupuncture to treat mental diseases. This part of the acupuncture point operation is straight step 0.8 to 1.2 cun. The acupunctures of the lower abdomen begin from 天枢 to 气冲. They can treat gastrointestinal diseases, genophage, and male diseases such as abdominal distension, probramus, constipation, dysentery, vomiting, dysmenorrhea, irregular menstruation, hernia, edema, spermatorrhea, premature ejaculation, infertility, and so on. On the operation, you can straight step 0.8 to 1.22. There are 15 acupoints in the lower limbs. There are 4 points in the side from Biguan to Lianquan. The 4 points of the sign are mainly used to treat diseases of the lower limbs. They can treat foot numbness, waist and leg pain, lunar and cross pain, nickled abdominal distension, cold hernia, abdominal pain, and other diseases. On the operation, you can straight step. There are 6 points in the lower leg from 足鼻 to 下巨虚. They are 足鼻足三里, 上巨虚丰隆条口, and 下巨虚. These 6 acupuncture points have a wide range of therapeutic effects and are rarely used. The operation is basically all straight step. We are going to focus on 足三里. The patient is supinating with the lower extremities extended. It is on the anterior lateral side of the shank, straightened below 足鼻. One horizontally placed finger distance lateral to the anterior border of the tibia, the C point, earth point, and 4 common points. It can be used for the treatment of stomach pain, vomiting, abdominal distension, diarrhea, constipation, and other gastrointestinal diseases, leg pain, stroke, paralysis, and other lower limb diseases. Asthma, vertigo, mania, insomnia, heart palpitation, and other diseases caused by sputum, intestinal carbuncle, breast carbuncle, gastroptosis, nephroptosis, and other diseases. It can also make the body strong and play a role in healthcare. Now it is mainly used for acute and chronic gastritis, gastric, or duodenal ulcer, acute and chronic pancreatitis, hepatitis, dyspepsia, acute and chronic enteritis, bacteria, dysentery, shock, neurotic headache, hypertension, epilepsy, neurococenia, schizophrenia, arteriosclerosis, bronchial asthma, leukopenia, scatia, lower limb paralysis, leg and surrounding soft tissue disorders, and so on. The operation is mainly perpendicular acupuncture 0.5 to 1.5 cun. Moxibustion is applicable. There are 5 points in the foot from the beginning of 解析 to 立对. The 5 points of the foot also have a wide range of therapeutic effects, including proximal and distal. Its vascular effect basically is the diseases of head and facial features, the diseases of place of meridian circulation, and cancellous diseases such as schizophrenia, neurasthenia, dyspepsia, and so on. The operation is straight stop. Finally, comes to the matters leading attention of acupuncture and moxibustion. For the acupoints of the face, the latter need to be slow and prevent bleeding and hematoma. The Chenqi acupoint in the orbit must be handled carefully. For the acupoints of the neck, which has important blood vessels including the carotid artery and the trachea, we must memorize its operation notes. For the acupoints of the chest, request a solo step, otherwise may injure the heart and lung or cause pneumothorax. Facial and joint points have a general requirement is not directly moxibustion, especially scar moxibustion to avoid facial scarring and block the joint movement. This meridian ends here. Please take the course of acupuncture for more details. Thank you.